Hello colleagues, welcome to our first lesson on YouTube, and today I'll be covering nursing care delivery models, also called systems of nursing service delivery. So as we start, I would like us to look at the definition of nursing care delivery model and also try to understand to explain the advantages and disadvantages of the different models of delivery, nursing care delivery. So by definition, even as I look for the mother nursing model. The mother nursing model is functional nursing. So we're saying by definition it is the manner in which nursing care is organized and provided. Nursing care delivery model is the manner in which nursing care is organized and provided. Therefore, we have a nursing manager in an hospital who is responsible for nursing care delivery systems, and the person ensures that there is quality care provided to all patients. Now, the factors that determine the choice of nursing care delivery model include the levels of nursing training. All of us know that we have degree nurses, we have diploma nurses, we have certificate nurses, and neither could you perform duties or the specific roles that are meant for a nursing specialist when you are just a nursing practitioner. Maybe you have a degree and you want to perform the roles of a nurse with a master's degree, or you are a certificate holder in nursing and you want to perform roles of a degree nurse. It doesn't work that way. So levels of nursing training determine the choice of nursing care delivery model. The nursing staffing levels, the actual number of nurses in an hospital, will also inform the decision of the choice of nursing care delivery model. The third one is category of patients being nursed. Now, let's straight away look at functional nursing. But before that, I'll mention all the various types of models, nursing care models. So we have from functional nursing at the tower, it is the mother model, and the rest of this are total patient care, team nursing, modular nursing, and primary nursing. So functional nursing, by definition, or what do you understand by functional nursing? We say functional nursing is a supervisory model that delegates tasks to nursing and auxiliary personnel. So somewhere we have a head nurse who assigns functions to other nurses, and the other nurses perform the nursing tasks to all the patients in a unit. The functional nursing model is hierarchical in nature because we have a registered nurse who takes care of complex jobs while the junior staff oversee the basic tasks. So the advantages, as you can see on the screen, are those, and disadvantages, but I could like to break them to a language that all of us can comprehend. So the advantages of functional nursing include nurses complete work within the shortest time possible. You can see that as point number 4. Saves time because it lends itself to strict organizational protocol. Roman 2, nurses gain career skills faster. Yeah, there is specialization in carrying out various nursing duties. We can marry that to Roman 1, point number 1. So nurses gain career skills faster. Roman 3, efficiency in providing nursing care. There is efficient and it's efficient and economical. So what we are talking about. Then promotes teamwork. There is another point there of less equipment is needed. And all of us know if you add one blood pressure machine, it can be shared by the staff in a department where possible. Now, disadvantages, we are saying it may hinder the provision of holistic care, risk of lack of continuity of care. Sometimes you could be working in a place where the number of patients is high and you are alone. Therefore, you may not be able to provide holistic care, comprehensive care to the patient. So may affect nurse-patient relationships. We are saying that functional nursing may affect nurse-patient relationships. It may not be practically possible to establish relationships with patients. A good example is when you are in medical ward and you have around 100 patients to take care of, Okay, it's very possible that you will only be able to recall on a few names. You will only remember a few patients by their names because the amount of work that will be involved will take a serious toll on your energy. You are not likely to provide good care. So may limit the growth of registered nurses, that is another disadvantage, and also affect the nurses' morale. Those are disadvantages of functional nursing. So by what we have on the screen, disadvantages, it's a very fragmented method of nursing care. It does not allow individualized clients care and therefore is incompatible with the nursing process. 2, risk of lack of continuity of care. 3, staff may become bored and have little motivation to develop self and others. Then the other one is that clients may tend to feel insecure, not knowing who is their own nurse. So those are the disadvantages of functional nursing. Just to break it, to reiterate on what we talked about, said functional nursing is a supervisory model that delegates tasks to nursing and auxiliary personnel, so that the head nurse assigns functions to other members of the healthcare team, to other nurses who perform the nursing tasks to all patients in a ward or just in a unit. So functional nursing modalities or models are hierarchical or hierarchical. I don't know how you pronounce that, because the registered nurse will take a bulk of the complex jobs, while the junior nurse and the orderlies oversee the basic tasks. Now, let's look at another type of model. Of course, they fall under functional nursing. I remember I mentioned them. We have team nursing, we have total patient care, we have case what? We have case management. Is case management same as that one? I think you need to think about it. Is case management same as total patient care? No. So case management, total patient care, team nursing, modular nursing. So let's look at team nursing, which we'll define as team nursing. We'll define it as a designated group, a type of nursing care model where a number of or a group of patients is cared by a team of 2 or more nurses. That is all about it. 2 or more nurses take care of a group of patients. But more importantly is that they will take responsibility for the actions. Whatever they do the reporting, they're the ones who do the assessment, the planning of care, they implement their plan of care, and also they evaluate patient outcomes. Now, team nursing, we are saying a registered nurse who acts as a team leader, coordinates a group of patients while working with the other team members. That is the summary that we can derive from all that is on the screen. So let me I wanted to set up a slideshow. I forgot. I'll do that. So primary nursing, we are saying when a ward is organized like that, such that there is a team leader. There is a team leader, and tasks are allocated to the group of nurses who also take care of a group of patients. That is called team nursing. So it is all about helping each other. The nurses help each other, and the nurses help the patients actually get well, or they take care of the patient's needs to ensure that the patients get well or recover from their illnesses. Now, team nursing promotes more clients contact than primary nursing. That one you should know. The client satisfaction levels are likely to be high. Team nursing is based on a philosophy that supports the achievement of goals through group action. That is very true. Yeah, all the same in our endeavors, in our daily endeavors, sometimes we get together as a team because it's better to achieve more than when you work alone. So this is the concept behind that even when nurses team up, they can achieve more than working individually. So the advantages are just like they are on the screen. We are saying high quality comprehensive care, and each member of the team is able to participate in decision making and problem solving. If there is a problem, they can put their heads together and find a solution to a problem. So when you are a team, you can actually find solutions to problems by just meditating or trying to brainstorm amongst yourselves. We are also saying that it is cost effective because of the reason that is given here. It works with the expected ratio of unlicensed to licensed personnel. Team nursing is an effective method of patient care delivery and has been used in most inpatient and outpatient healthcare settings. Is the most adopted model. Although you remember we are talking about these models in the Kenyan setting, so you will need to answer this question: which is the most adopted nursing care model in our hospitals? In our hospitals, public hospitals especially, because we've been having our shifts there, rotations there, we can tell. Now, advantages is that the advantages continued is that we have also talked disadvantages. Sorry, let's move to disadvantages. Establishing a team may take time because you have to find people who actually get well together, because you can simply create a team where people do not pull in one direction, and then simply will be creating a group and not a team, because when even they don't agree or even differ to agree, that won't be a team but just a group which may not achieve any of the objectives they had set. So unstable staffing patterns make team nursing difficult is another disadvantage. And then there is less individual responsibility and independence regarding nursing functions. Those are disadvantages. Again, this is to do with the team leader. The team leader may not have the necessary leadership skills to ensure that he or she directs the team appropriately, to ensure that there is team spirit. So where a team leader lacks the necessary leadership skills, the teams won't perform, and of course there will be a problem in relation to patient care. The patient's needs will not be catered for appropriately. There might be insufficient time for care planning and communication. There may also be unclear goals. So for those of us who understand, at times you can have a group and the group doesn't perform. When there are many people, of course, you are rushing for strapping, another one is rushing for the same. You're looking for a blood pressure machine and someone else is looking for it. That means there isn't proper coordination. So let's look at primary nursing. Primary nursing has been defined as we define primary nursing as a method of nursing practice which emphasizes continuity of care by having one nurse, who is called the team nurse, provide complete care for a small group of inpatients within a nursing unit of a hospital. Sometimes they say a nursing assistant. So team nursing is where we have a team nurse, is it a team nurse? Yeah, sorry, a primary nurse. Sorry for the confusion. Primary nursing, the registered nurse assumes accountability for the care of the primary patients. All the nurses in a functional nursing team need to perform their duties and assume responsibility for caregiving. So there we have a primary nurse, we have a nurse which they say on the screen often termed as a nursing assistant, who provide complete care for a small group of inpatients within a nursing unit of a hospital. The primary nurse is responsible for coordinating all aspects of care for the same group of patients throughout their stay in a given area. So what happens here? A nurse who is referred to as a primary nurse takes care of patients within their stay in hospital. They are allocated a group of patients and you take care of their stay in hospital. All their needs, whatever care they are to receive, that will fall squarely on the primary nurse. Is the one to plan or for their services, for them to get services in the hospital. So advantages of this kind of model is that there is division of labor, because again a nurse has been allocated duties and duties to perform solely. So there is opportunity for nurses to see clients and family as one system or unit. There is nursing accountability. When we know who is responsible for what, when you know the nurse who is responsible for a group of patients, then of course that nurse is held accountable for any of the actions, for anything else that might happen. So there is nursing accountability. This model, primary nursing model, facilitates or enhances nursing accountability. The nurse is able to use a wide range of knowledge, skills, and expertise, as they deal with the patients. Work satisfaction may increase. Sometimes, we also want to be bosses somewhere. We want to have some say, even as we provide care to patients. Sometimes we want to be solely responsible or the one in charge of a certain unit or a section. So this one ensures or promotes satisfaction, work satisfaction. The scene is set. There could be increased trust and satisfaction by the client and the nurse. So because of the increased interaction between the nurse and the patients, the scene is set for increased trust and satisfaction. Those are the advantages of primary nursing. Disadvantages include if you have an uneducated nurse, an inadequately prepared nurse, then what could he or she be doing to the patients? A lot of disservice. So you find they don't inform the other healthcare team. They don't plan for the services that the patient should receive, like radiological investigations, because they didn't even identify the needs of the patient. So you find they don't inform the other members of the healthcare team. They cannot work in a multidisciplinary team. So, and because of that, the patient's condition may deteriorate. They may not be able to identify the complex needs of the patient. So when the nurse is uneducated or incompetent, that is what you expect. Now let's look at disadvantages. We looked at advantages of a primary nursing. Of course, there are other models like caseload management or case management. Normally we refer to it that way. And we said with case management, this is a type of management system, case management nursing system. The registered nurse designated as the case manager supervises the patient's care and the utilization of resources. We have a case manager who supervises the patient's care and then of course also manages resources within that setting. So what is on the screen there is that it's a popular method of organizing nursing in the community setting. A specific nurse is a caseload manager. You are the specific nurse or the case manager is allocated or is in charge of a group of patients, which we refer to as the load, and ensures that their needs are met, they are given proper care, and that resources are utilized properly. That is why when we use gloves in a way that a nursing manager, an in charge, realizes that's not proper, of course they reprimand. They will speak that out and say that we employ or we do proper use of the equipment or whatever resources are available. So if we look at, for example, in the ICU, the method that is practiced there is caseload management. Private duty nurses practice using this method or design, and especially in units such as the intensive care unit. Advantages of this method is that provides nurses with high autonomy and responsibility, of course, and assigning patients is simple and direct and does not require the planning that other methods of patient care delivery do. The points are straightforward. I may not need to explain. Let me just read through. Continuity of care is maintained because the teams are organized to ensure that a member is available every day of the week. Can you miss a nurse in a ICU? I mean, there are nurses there. There is someone always in charge of the group of patients. And in some hospitals, I'm told you could find one nurse, one patient. But the system is in such a way that there is continuity of care. It's maintained. Continuity of care is maintained. This system is less affected by the shift system. Clients may feel more secure. That's what we say. Disadvantages: nurses are not enough to comply with the demands of this model. Yeah, like we said, it's not practical. You may not have adequate staff to take care of that. For total patient care, and in total patient care, the registered nurse assumes responsibility for a specific round or shift. Is this same as case management? You know, guys, these things really confuse. But we are saying in total patient care, the registered nurse assumes responsibility for a specific round of or shift. The nurse provides and manages all the care for the patient. Advantages: it ensures a total continuity of the shift by ensuring total coverage of tasks. Total patient care, the registered nurse assumes the responsibility for a specific round or shift. The nurse provides all the care. The nurse provides all the care. The nurse provides and manages all the care for the patient. Advantages, we have said, ensures a total continuity of the shift by ensuring total coverage of tasks. Disadvantages: can be costly, as the registered nurse is the only one providing care. There might be delays in the administration of care and providing inefficient time. I didn't see whether that was available in our slides. Haven't seen where we are discussing total nursing care. But if I find, yeah, and that is it. Then I think up to that end, we're also piloting to see whether we can have our lessons on YouTube so that we have flexibility in terms of time. What we're able to do is that if we post these videos on YouTube, when you are free, you can just by tapping on a link get to listen to some lesson presented by any one of us. Yeah, because I understand many of our colleagues are tied up, are held up somewhere. There are those who are lucky enough to get some kibarua elsewhere. So, and we really care that if we can help them this way, they'll be able to learn and together as team move together. And especially those colleagues of us, our friends who are preparing for FQE, we can harness, we can use this platform, we can do these things this way, and we enrich ourselves with knowledge for the exam that is forthcoming. I think they're doing it in January. So God bless you. Thank you for listening. This was just a trial. Don't go in discrediting every little effort that we make to ensure that this thing works. It is a trial. Whether it was perfect or not, we are trying things out. Next, we also expect any one of us to do that. We also want to check on the video size, see whether this thing is practical, whether it can be used, during our learning sessions. Thank you guys. Thank you for listening.